Right now, one of the things sitting on your plate could be quietly damaging your dog's liver, and there is a good chance you handed him a piece of it this week without thinking twice. 99% of owners feed at least one of the 5 things you are about to see, and most have no idea any of them are dangerous at all. Before we get into what they are, there is one thing almost every owner gets backwards. Most people treat table scraps like one big category. A little bit is fine, a lot is risky. That works for greasy leftovers. It does not work at all for the first item on this list, where the amount barely matters, which is exactly why we start there. And if you feel a little sick to your stomach thinking about what you handed him last weekend, that is normal, and it does not make you careless. Nobody sits new owners down with a list like this before they bring a dog home. Watching closely enough right now to change 5 habits already says something about how much you care. The first one is the one most people never see coming because it does not look dangerous at all. It is xylitol, a sugar substitute that shows up in sugar-free gum, some peanut butters, low-sugar baked goods, mints, and even certain toothpastes. Here is what happens inside your dog when he eats it. His body cannot tell the difference between xylitol and real sugar, so his pancreas floods his bloodstream with insulin to deal with a sugar rush that never actually shows up. Blood sugar crashes fast, sometimes within 30 minutes, and at higher amounts the liver cells themselves start to fail within a day or 2. There is no safe home dose here, not a small taste, not once in a while. A few licks of the wrong peanut butter is enough for a small dog to end up in an emergency clinic. That single fact is why checking the label every time before you share peanut butter matters more than almost anything else on this list. Look for xylitol or birch sugar in the ingredients, and if it is there, that jar does not go near your dog's bowl, ever. Keeping one dedicated xylitol-free jar just for him removes the guesswork completely. If you know or even suspect he got into something with xylitol, this is not a wait-and-see situation. You call your veterinarian or the ASPCA Animal Poison Control Center right away. Watch for shakiness, sudden weakness, vomiting, or wobbliness in the next couple of hours after any suspicious snack. Early treatment turns a scary night into a full recovery, and waiting turns it into something much worse. The amount that matters is smaller than most owners guess, and it does not scale by size the way you might expect. A single piece of sugar-free gum can be enough for a small dog, and even a large dog only needs a few pieces before the same crash starts. There is sort of a safe dose by size, actually. It is just 0 no matter what size he is. If your dog has an existing liver concern your veterinarian is already tracking, mention this ingredient by name at his next visit. Now, if you have got this far and you are already thinking of your own dog under the table at dinner, comment where you are watching from, hit subscribe if this kind of clear, practical breakdown is useful to you, and give this a like. It genuinely helps more owners find these 5 before their dog runs into one of them. None of that costs you anything, and it means a lot more dogs get protected. The second one hides in plain sight because it looks like the least offensive scrap of all, just meat. Bacon, gravy, fried skin, the fatty trimmings you cut off before eating. A sudden greasy load can overwhelm your dog's pancreas, the organ that makes his digestive enzymes, and in some dogs that overload turns those enzymes against the organ itself. That is pancreatitis, genuinely painful, not the kind of upset stomach that clears up with a skipped meal. For a small dog under 20 pounds, a single tablespoon of pure fat can set this off. Medium dogs tolerate a little more, larger dogs a bit more still, but none of them are built for a holiday plate's worth of drippings. If you want to share, plain cooked lean meat with the fat trimmed away is the safer version of the same gesture. Signs to watch for are a hunched posture, a belly that seems tender when he is picked up, and a dog that suddenly will not touch his usual food. That combination, more than vomiting alone, points toward the pancreas specifically, and it is worth a same-day call to your veterinarian. One mistake that trips up a lot of owners is thinking pancreatitis is a one-time scare that never comes back. For some dogs it can, but a pancreas inflamed once is more sensitive to the next greasy plate, so what felt fine last Thanksgiving is not guaranteed to feel fine this year. And here is something worth sitting with for a second before we keep going. What you have just seen with the first two items rarely stands completely on its own, and neither does what is still coming. 3 more items, 3 more organs, and one connection near the end that changes how you look at all 5 together. A sign like sudden fussiness with food or a little extra sluggishness after dinner is usually one piece of a bigger picture your dog is showing you day to day, not an isolated event. If you are not sure how the pieces of your own dog's picture fit together, or which one deserves your attention first, we put together a free 2-minute quiz that reads that full picture and cuts it straight down to the one place to start. You will find the link in the pinned comment, or you can scan the QR code on the screen right now. Finish this video first though, because the biggest piece of this particular puzzle is still ahead. Picture a dog like a food-motivated retriever mix named Biscuit, the kind who parks himself under the table at every single meal without being asked twice. One holiday afternoon, he gets a piece of gravy-soaked turkey skin from a well-meaning guest, and later that evening, 2 grapes a toddler drops on the floor. Within a few hours, he is vomiting and hunched over, clearly uncomfortable, and his owner's veterinarian runs blood work that points to both pancreatitis and early kidney stress at the same time. With fluids and a bland recovery diet under veterinary care, Biscuit turns a corner over the following days. It is a good reminder that these risks are not always one scrap events. They can stack on top of each other in a single afternoon. The third item is the one that surprises people most because everyone assumes cooking makes food gentler. It does not for this one. Onion and garlic, in any cooked form, soup, gravy, seasoned meat, sauce, contain a compound that attacks the surface of your dog's red blood cells and ruptures them. Fewer healthy red blood cells means less oxygen moving through his body, a condition called hemolytic anemia, and it rarely shows up right away. That delay is what makes it dangerous. A dog can look completely fine for a day or two after eating something seasoned with onion or garlic, then suddenly seem weak, tired, or short of breath on a walk that never used to bother him. Garlic is several times more potent than onion by weight, so a single clove matters far more than people expect. Roughly half an ounce of onion per 10 pounds of body weight starts to be a real concern. But honestly, the safer home rule is just none at all, rather than trying to estimate a safe crumb of leftover casserole. Pale or even slightly yellowish gums, best checked by gently lifting his lip, are one of the clearest signs something is wrong here, along with unusual tiredness that does not match his normal energy. If you notice either one within a few days of a seasoned meal, that is worth a same-day call to your veterinarian, not a wait-it-out approach, since the anemia can keep getting worse after the exposure itself is long over. Powdered and dehydrated forms deserve a mention too, since onion powder and garlic powder are more concentrated than the fresh version, and they hide inside seasoned rice, gravy mixes, and even some baby food that gets shared as a soft, easy treat for an older dog. If your dog has already gotten into something with onion or garlic in it and seems fine right now, that is not the same as being in the clear, since the anemia often takes a day or two to show itself fully. One thing that trips owners up here specifically is history. A dog that ate a scrap of seasoned chicken once with no visible problem does not mean the next time carries the same odds, since these compounds build up gradually inside the blood cells, rather than washing straight out. Treat every exposure as its own event, not evidence that he is somehow immune. The fourth item has almost no room for error, and it might be the most unsettling one on this entire list, because grapes and raisins can hurt a dog in amounts that sound almost too small to matter. Something in the natural acids of the fruit damages the filtering tissue inside a dog's kidneys, and in some dogs it can shut urine production down almost entirely. Nobody has ever pinned down a safe amount, which is exactly why veterinary guidance treats every ingestion the same way. Seriously. This one is not just fresh fruit either. Trail mix, granola bars, fruitcake, and some homemade cookies hide raisins where you would not expect them, tucked into a texture that does not scream fruit at all. Because there is no known safe dose, even a single grape for a small dog is treated as an emergency call to your veterinarian or the ASPCA Animal Poison Control Center, not something you monitor from the couch. Dark tea-colored urine, or noticeably less urine than usual over the following day, is the sign that points most directly to the kidneys struggling. Lethargy and a lost appetite often follow. Catching it in that first window, before kidney function drops further, is what makes the difference between a full recovery and lasting damage, so speed matters here more than almost anywhere else on this list. There is one more wrinkle worth knowing. Some dogs eat grapes their whole lives and never have a problem, which is exactly what makes this one so hard to predict and so easy to get complacent about. That inconsistency is not a reason to relax. It is the reason vets treat every single ingestion the same way, rather than judging by what happened last time. And now the last one, the one hiding on almost every holiday table, the one that has nothing to do with organs at all, and everything to do with what happens on the way down. The cooked bone. It looks harmless sitting on the edge of a plate, maybe the most harmless looking thing on this entire list, and that is exactly the problem. A raw bone still has moisture in it, so it bends a little under pressure, like a green stick. Cooking pulls that moisture out, which means a cooked bone, chicken, rib, steak, turkey carcass, does not bend at all anymore. It shatters into sharp shards. Those shards can slice the inside of his mouth or throat on the way down, get stuck in the esophagus, or work their way into the intestines and cause a blockage that needs surgery to fix. This is the item most owners never connect to danger at all, because dogs have chewed on bones for as long as dogs have existed. But a wild dog gnawing a fresh kill and your dog cracking into a dried-out holiday rib bone are two completely different physical situations. Drooling, gagging, repeated swallowing, or a sudden refusal to eat after a bone-containing meal are all signs a fragment may be stuck somewhere it should not be, and none of those wait until morning. If you want to give him something to chew, a raw, veterinarian-approved chew, sized correctly for him, given while you are in the room, is the version of this instinct that does not send you to an emergency vet at midnight. Small dogs and large dogs run into different versions of this same problem. A tiny dog can choke on a fragment. A large dog would swallow without noticing, while a large, enthusiastic chewer is more likely to bite down hard enough to shatter a bone into several sharp pieces at once, instead of just gnawing at it slowly. Neither situation is safer than the other. They are just different shapes of the same risk, which is why the safest answer is the same, regardless of his size: no cooked bones ever off any plate. Here is the part that ties all 5 of these together, and it is the piece most owners never think about until it is too late. These risks do not stay separate inside your dog's body, they lean on each other. One weak organ makes the next hit land harder, and that is the real reason a habit of small scraps adds up to more than any single one of them would on its own. A liver that has already been strained by repeated fatty scraps has a harder time buffering even a small xylitol exposure later on. A dog carrying quiet kidney stress from a grape he ate weeks ago often shows it secondarily. A little less appetite, a coat that looks slightly duller than it used to. Protecting the liver, the kidneys, and the pancreas together, instead of worrying about one organ at a time, is what actually keeps a dog thriving well into his senior years. And it is why this list is really one story about his whole body, not 5 separate warnings. Once you have gotten past the immediate danger, the habit that keeps him steady long-term is simple. Keep his regular food consistent and treat the occasional safe extra as a genuine extra, not a daily habit that quietly becomes the norm again in a month. Dogs recovering from any of these 5, especially pancreatitis or kidney stress, do best on the plain diet their veterinarian recommends for a stretch afterward, even once he seems back to normal, since the organs involved can take longer to fully settle than his appetite does. If you decide to bring in new, safer foods to replace the scraps you are cutting out, add them one at a time, spaced a few days apart. His stomach does not handle several new things at once well, and slow rotation also makes it much easier to spot exactly which food caused a reaction if one ever shows up. Beyond these 5, chocolate, alcohol, raw yeast dough, macadamia nuts, and concentrated essential oils belong on the same do not share list, worth keeping in the back of your mind at every gathering. None of these situations are ones to manage by watching and waiting at home. The window between the first symptom and real organ damage can be under 24 hours, for xylitol and for grapes especially, and any known or suspected ingestion deserves an immediate call to your veterinarian or the ASPCA Animal Poison Control Center at 888-426-4435, staffed around the clock. Do not try to induce vomiting on your own without guidance, since in some situations that can make things worse rather than better. If you ever do make that call, grabbing the packaging, or even just knowing roughly how much and how long ago, makes a real difference in how fast a veterinarian or the poison control team can advise you. Guessing costs time, and time is the one thing none of these 5 situations give you much of. It sounds obvious once you hear it, but in the moment, most owners forget it completely because they are focused on the dog, not the wrapper on the counter. Part of why this list catches people off guard is that the treat industry rarely spells out which human foods are genuinely dangerous versus just messy or unnecessary, since a clear 5-item warning does not sell another bag of anything. Some labels use soft phrasing like natural sweetener that lets an ingredient like xylitol hide behind friendlier words on the shelf. Reading past the marketing and actually checking the ingredient list protects your dog more than any product sitting next to it ever will. So quickly, the 5 to keep off his plate for good. Xylitol, the one your dog's liver cannot forgive. Fatty scraps, the ones that overload his pancreas. Onion and garlic, the ones that quietly damage his blood. Grapes and raisins, the ones his kidneys cannot filter. And cooked bones, the ones that turn brittle and dangerous the moment they hit the pan. 5 distinct risks, 5 distinct organs, and now you know exactly which crumbs are worth stopping before they hit the floor. If this changed how you will handle dinner tonight, subscribe for more of these, and that free 2-minute quiz is still waiting in the pinned comment or the QR code on screen whenever you are ready for it. Drop the number of the one that surprised you most in the comments, 1 through 5. It genuinely helps shape which list we cover next. And whatever you do tonight, maybe just let him have his regular food and a little extra scratch behind the ears instead. He will not know the difference, and his body will thank you for it.